John! Come on. Took you long enough.
So, I have an idea. Do either of you know what quality of life assessments are?
No.
So, quality of life assessments are questions that ask you about various aspects of your life. They ask about your level of independence, satisfaction with treatment and care, comfort, social well-being, and more. They ask you to think back on a specific period of time, like the last 2 days or this past month.
Okay. And then how is this used? And how is this beneficial to my dad?
Actually, you both will be able to use them to better your health, both as patient and as primary caregiver. So if you so choose, your results are reported directly to me and your other healthcare providers, and I look at them together with the typical data and assessments I use to better your health in a way that's personalized to each of your needs. They may even bring up aspects of your health that you haven't had the opportunity to think much about. There's even one assessment that is specifically suited to your arthritis, John.
Huh?
You interested in giving it a whirl?
Well, I guess I'm interested in trying it if my dad is. I mean, what do you say? I guess it's time to try something new, huh?
Well, let's get started already.
So you can easily pull up any assessment I assign for you to do through the internet. The first one I'll have you do begins with this question. Over the past 2 days, communication with people you care about has been 0, difficult, to 10, very easy. Okay? Or for John, in the last 2 months, I have felt that I've had time for self-care, never, rarely, some of the time, or all of the time.
Wow, never even thought of that.
Well, you both have still consented to share your quality of life results with each other, which seemingly has also helped with your mutual communication and understanding. So now let's discuss your results. Ralph, it looks like there's been some improvement in your overall life satisfaction with the addition of music in your room, which seems to also allow John more time for his self-care. In comparison to my other patients, you're also doing well. Ralph, your disease seems to be managed for the time being. Although, it looks like you still are unsatisfied with your mobility. Well, there is a physiotherapist that some of my other patients recommend, whose office actually isn't too far from where you're at. So I'll send you home with his information, and you can decide if he's a good fit.
That would be great, thanks.
Great.
Thank you.
Otherwise, keep it up. In the meantime, I'm assigning you both another assessment.